Good day, everyone. So, for today's discussion, we will talk about hypertension. Me, Lynette, Caldo, and Mheian Villaluna will explain to you the brief anatomy, physiology, the pathophysiology of the disease process, clinical manifestation, assessment and diagnostic findings, medical and pharmacologic therapy, and the nursing process, which involves the assessment, the diagnosing, the planning, interventions, and evaluation. Hypertension or increased blood pressure is the leading risk factor for death and for disability globally according to the World Health Organization. It contributes to the burden of heart disease, stroke, and kidney failure, and premature mortality and disability. It disproportionately affects populations in low and middle-income countries where health systems are weak. Hypertension rarely causes symptoms in the early stage and many people go undiagnosed. Those who are diagnosed may not have the access to treatment and may not be able to successfully control their illness over the long term. Increased blood pressure was the cause of an estimated 9.4 million deaths and 162 million years of life lost in 2015 and the cause of 50% of heart diseases, stroke, and heart failure, 13% of deaths overall, and over 40% of deaths in people with diabetes. Hypertension is a leading risk for fetal and maternal death in pregnancy, dementia, and renal failure. Now, let's discuss the anatomy and physiology of the heart. Veins are blood vessels containing blood flowing to the heart, while arteries have blood flowing from the heart. The blue is a representative of blood vessels containing the oxygenated blood, while the red blood vessels have oxygenated blood fresh from the lungs. The superior vena cava receives blood from the head, neck, upper limbs, and chest. Meanwhile, the inferior vena cava receives blood from the trunk, the viscera, and lower limbs. Both superior and inferior vena cava end up in the right atrium, one of the four chambers of the heart. It also has four valves. The purpose of valves is to keep blood moving in the right direction and not flow backwards. Blood exits the right atrium through the tricuspid valve, so called because it has three flaps, and enter the right ventricle. The blood exits the right ventricle through the pulmonary valve and enters the pulmonary artery. Again, it is an artery because blood is flowing away from the heart, but it is blue because it lacks oxygen. The pulmonary artery then splits into the left and right pulmonary arteries, which go to each respective lung. In the lungs, gas exchange occurs. The blood discards carbon dioxide and picks up oxygen. Now, blood comes back from the lungs through the pulmonary veins, entering the left atrium. Next, the blood is pumped into the left ventricle through the mitral or bicuspid valve. Finally, the oxygenated blood leaves the left ventricle through the aortic semilunar valve, entering the aortic arch. The aorta, which is the largest of all arteries, distributes the oxygenated blood to the rest of the body. The aortic arch has three major branches, which supplies the head and arms with blood. Then the aorta curls downward from behind the heart, forming the descending aorta, which descends through the chest and continues down through the abdomen. In the abdomen, the descending aorta splits to supply the pelvis and legs with blood. When your heart beats, it pumps blood around your body. As the blood moves, it pushes against the side of the blood vessels. The strength of this pushing is your blood pressure. As your heart pumps, the flow of the blood in your arteries and in your blood pressure rises and falls in a regular wave pattern. Blood pressure is shown as two numbers. The top number or systolic pressure is the pressure when your heart beats. The bottom number, or the diastolic pressure, is the pressure when your heart relaxes. Healthy blood vessels can stretch to allow for these changes in pressure. Damaged blood vessels are less stretchy when increased blood pressure. Constant high blood pressure puts extra strain on the heart and blood vessels. Over time, this increases the risk of heart attack or stroke. It can also cause problems for the eyes and kidneys. High blood pressure speeds up the process of atherosclerosis, where fatty streaks form inside the arteries. If one of these cracks, it can cause a blood clot in your arteries. This is what causes a heart attack or stroke. So let's go to the pathophysiology of the hypertension. Factors such as predisposing and precipitating factors contributes to the developing of hypertension of a person. Common precipitating factors which leads to hypertension are smoking, stress, salt intake, obesity, and alcohol consumption. Smoking is one of the causes of hypertension and other cardiovascular diseases like myocardial infarction, stroke, and even sudden coronary death. When a person gets exposed to tobacco smoke and active smoking, the number of segments of intracranial arteries increases. Thus, it is associated with the deterioration of health status. On exposure to cigarette smoke, there is a reduction in the nitric oxide, which is a vasodilator, and initiates vascular damaging that leads to increased addition of platelets and macrophages, which in turn enhance the inflammatory response. It also leads to tissue damage and its remodeling and its structure of the vessel changes. The stress is associated with high blood pressure. Due to an increase in stress level, the sympathetic nervous system activates and hence results in increased blood pressure. By blocking the orexin receptor, the blood pressure can be reduced because on its blocking, cardiovascular system does not respond to stress. Salt intake leads to high blood pressure because of increased plasma volume and cardiac output, improper function and activation of sympathetic nervous system. The hypertension, which are common in adults, are now becoming popular in obese children than children bearing normal weight. The most significant cause of hypertension is obesity in patients suffering from essential hypertension. The factors which indicates the relation between the hypertension and obesity are oxidative stress and inflammation, vascular injury, impaired autonomic nervous system. Salt intake leads to high blood pressure because of increased plasma volume and cardiac output, improper function and activation of sympathetic nervous system.
Hypertension, also known as high blood pressure. It is a condition that arises when the blood pressure is abnormally high. Hypertension occurs when the body's smaller blood vessels, the arterioles, narrow, causing the blood to exert excessive pressure against the vessel walls and forcing the heart to work harder to maintain the pressure. Although the heart and blood vessels can tolerate increased blood pressure for months and even years, eventually the heart may enlarge. It is also a condition called hypertrophy and be weakened to the point of failure. Injury to blood vessels in the kidneys, brain, and eyes may also occur. Strain on the arterial wall, which would contribute to a rise of collagen and calcification of the arterial tissue, leading to a loss of elasticity that would cause atherosclerosis in intima and narrowing of the blood vessel lumen, which would cause the stiffness of the aortic perineal artery, which would contribute to the constriction of arterioles. Constriction of arterioles would lead to neurologic, cardiovascular, and renal damage. For the neurologic, the constriction of arterioles would lead to decreased baroreceptor sensitivity that would lead to chronic hypertension, and there will also be changes in CSF pressure, decrease in cerebral perfusion, and the decrease in cerebral oxygen supply that would result to memory impairment, dull headache, vertigo, and tremors. That would also lead to cerebral edema that would cause retinal hemorrhage, blurred vision, TIAs or transient ischemic attack, epistaxis, cerebral hemorrhage, cerebral aneurysm, and cerebral thrombosis that would later on result to death. Next is the cardiovascular. The constriction of arterioles would lead to increased total peripheral resistance or the TPR. That would also lead to increased peripheral vascular resistance or the PVR. That would cause the increased cardiac output, which would lead to impaired myocardial oxygen, increased workload on heart, and increased myocardial oxygen consumption. That would result dyspnea on exertion, ventricular hypertrophy, and chest pain. That would cause cardiac decompensation, coronary artery disease, myocardial infarction, and cardiac failure, which would also lead later on to death. Next is the renal. The constriction of arterioles would lead to sympathetic stimulation that would cause aldosterone release, decreased renal blood flow, decreased renal oxygenation. That would cause ischemia of renal tissues and aldosterone secretion and increased blood pressure. That would cause nocturia, which would also lead to water retention and increased blood volume. That would result to azotemia, renal failure. That will also later on result to death.
There are several signs and symptoms a hypertensive person may manifest, but the common are dyspnea, fatigue, the headache, chest pain, dizziness, and increased blood pressure.
We will be discussing the diagnostic tests. First one is the urinalysis. It is used to screen for causes of secondary hypertension and to look for damages to the kidney. Next is the blood chemistry, which includes potassium, sodium, creatinine, fasting glucose, total cholesterol, and HDL cholesterol. Next is the ECG. It is a representation of the heart's electrical activity. Then we have echocardiography. It is an important tool in assessing wall motion abnormality in patients with suspected cardiac disease, which helps in searching an early diagnosis of myocardial infarction. Next is creatinine clearance. It is a 24-hour urine sample with creatinine level in your blood. Next is the renin level. It is done to find the cause of high blood pressure. Next is hemoglobin and hematocrit. Hemoglobin is a protein in red blood cells, and hematocrit is a measurement of the amount of red blood cells as related to total blood cell count. Next is the blood urea nitrogen. It measures the amount of nitrogen in your blood that comes from waste product urea. Next is the glucose. It is used to find out if your blood sugar levels are in the healthy range. Next is chest X-ray. It can show if your heart has become larger than normal. Then the CT scan is most useful in diagnosing other lung disease that may lead to increased pressures in the pulmonary arteries, such as blood clots, tumors, or interstitial lung disease.
Medical management includes lifestyle changes. First, eating a healthy diet, which includes the fruits and vegetables. Second, staying physically active, that includes a proper exercise. Maintaining a healthy weight, avoiding excessive alcohol consumption, quitting smoking and avoiding secondhand smoke, managing stress, eating less salt foods, limiting caffeine, and monitoring blood pressure at home. Its pharmacologic therapy includes diuretics, which used to promote diuresis and block the reabsorption of sodium and water in the kidney. Calcium ion antagonist, which is used to produce vasodilation and vascular smooth muscle. Adrenergic inhibitors used to impair synthesis of norepinephrine, suppression of sympathetic outflow by central alpha adrenergic stimulation, or blocking of preganglionic to postganglionic autonomic transmission. ACE inhibitors may be used for afterload reduction. These drugs inhibit angiotensin converting enzymes and prevent the conversion of angiotensin 1 to angiotensin 2, and are able to decrease the workload of the left ventricle to improve cardiac output, contraindicated in hyperkalemic and shock state. And lastly, the vasodilators, which are used to relax vascular smooth muscles, decrease preload and afterload, decrease oxygen demand, decrease systemic vascular resistance, and increase venous capacitance.
Next, we will be discussing about the nursing process. First one is assessment. Nursing assessment must involve careful monitoring of the blood pressure at frequent and routinely scheduled intervals. First one is assessment of patient's history to evaluate risk factors such as smoking or family history of hypertension. A complete history should be obtained to assess for signs and symptoms that indicate target organ damage. Next is perform physical examinations as appropriate. If patient is on antihypertensive medications, blood pressure is assessed to determine the effectiveness and detect changes in the blood pressure. Pay attention to the rate, rhythm, and character of the apical and peripheral pulses. Next is the retinas are examined to assess possible organ damage. Poorly controlled hypertension affects several systems such as cardiovascular, renal, cerebrovascular, and retina. The damage to these systems is known as target organ damage. It affects the eye, causing 3 types of ocular damage: choroidopathy, retinopathy, and optic neuropathy. Hypertensive retinopathy occurs when the retinal vessels get damaged due to elevated blood pressure. There has been significant evidence that hypertensive retinopathy acts as a predictor of systemic morbidity and mortality due to target organ damage. And lastly, laboratory tests is also taken to check target organ damage. For the diagnosis, first one is deficient knowledge regarding the relation between the treatment regimen and control of disease process. Next is a non-compliance with therapeutic regimen related to side effects or prescribed therapy. For the problems or potential complications, first one is left ventricle hypertrophy, myocardial infarction, heart failure, TIA or transient ischemic attack, cerebrovascular disease, renal insufficiency, and chronic kidney disease. And lastly, retinal hemorrhage. In planning, the major goals for a patient with hypertension are as follows: understanding of the disease process and its treatment, participation in a self-care program, absence of complications, BP within acceptable limits for individual, cardiovascular and systemic complications prevented or minimized, the disease process or prognosis and the therapeutic regimen understood, necessary lifestyle or behavioral changes initiated, and lastly, plan in place to meet needs after discharge. For the nursing interventions, the objective of nursing care focuses on lowering and controlling the blood pressure without adverse effects and without undue costs. First is promoting adherence to the therapeutic regimen. Mild to moderate hypertension may be controlled by a single drug regimen, although more severe cases often require a combination of 2 or more drugs. Diuretics are a common medication. These agents lower blood pressure primarily by reducing body fluids and thereby reducing peripheral resistance to blood flow. However, they deplete the body's supply of potassium, so it is recommended that potassium supplements be added or that potassium-sparing diuretics be used. Next is promoting home, community-based, and transitional care. For the effective treatment will reduce overall cardiovascular morbidity and mortality. Non-drug therapy consists of number 1, relief of stress, dietary management, restricted intake of salt, calories, cholesterol, and saturated fats, sufficient intake of potassium, magnesium, calcium, and vitamin C, regular aerobic exercises, weight reduction, smoking cessation, and reduced intake of alcohol and caffeine. For the evaluation, at the end of the treatment regimen, the following are expected to be achieved. First one is maintain blood pressure at less than 140 over 90 mmHg with lifestyle modifications, medications, or both. Next is demonstrate no symptoms of angina, palpitations or visual changes, has stable serum creatinine levels, has palpable peripheral pulses, adheres to the dietary regimen as prescribed, exercises regularly, takes medications as prescribed and reports side effects, measures blood pressure routinely, abstains from tobacco and alcohol intake, and exhibits no complications.